What I am about to explain may completely change the way you look at your blood pressure monitor. Because if you are over 60, the most dangerous blood pressure reading is probably not the one you have been taught to worry about the most. And when you understand which number quietly puts thousands of seniors on a path towards stroke, heart failure, cognitive decline, and emergency hospitalization, you are going to realize why so many older adults feel reassured by readings that are actually warning signs in disguise. This is one of the most misunderstood topics in all of senior health. And misunderstanding it does not just cause confusion. It can cost you years you believed you still had ahead of you. Right now, somewhere in this country, a senior is looking at a reading like 168/72 and feeling calm because the bottom number appears acceptable. Somewhere else, another senior is seeing 124/58 and feeling proud because the top number looks well controlled. And in both of those situations, danger may already be building silently beneath the surface. That is the part almost nobody explains with enough clarity. Blood pressure is not simply about whether a number is high or low. It is about which number is changing, why it is changing, what the aging process does to your arteries over decades, and what the relationship between those two numbers actually reveals about your real cardiovascular risk. I am Dr. Emily, and by the end of this, you are going to understand three things with complete clarity. First, which blood pressure number typically becomes more dangerous after age 60? Second, which blood pressure pattern lulls too many seniors into a false sense of security? And third, which reading means you should stop everything and seek emergency medical attention without delay? The answer is not as straightforward as saying the top number is always the villain and the bottom number is always harmless, or the other way around. In seniors, the nature of blood pressure danger changes shape. The rules that applied at 40 do not apply the same way at 70. And that shift in how risk presents itself is precisely why so many people miss the warning signs until something serious happens. Let me begin with Margaret, because her experience illustrates exactly how this confusion becomes dangerous in everyday life. Margaret was 71 years old. She was careful, disciplined, and genuinely committed to managing her health. Every single morning, she wrapped the cuff around her arm, recorded her reading in a small notebook, and reviewed the numbers with quiet attention. For weeks, her readings followed a consistent pattern. 162/74 one morning, 166/70 the next, 164/72 the day after that. She kept reassuring herself that because the bottom number stayed under 80, the situation could not be that serious. After all, she felt mostly fine. A little more fatigued than usual, slightly more breathless climbing stairs, but nothing that sounded like an emergency. Then, one afternoon, while folding laundry in her living room, her right hand suddenly felt weak. Her speech became thick and slurred for about 30 seconds, and then returned to normal just as quickly. It passed so fast she nearly dismissed it entirely. But what Margaret had experienced was a transient ischemic attack, sometimes called a warning stroke. And the reading pattern she had been brushing aside for weeks, that persistently elevated top number combined with a seemingly normal bottom number, had been telling the truth the entire time. Margaret did not have harmless blood pressure. She had one of the most common and dangerous blood pressure patterns seen in older adults. And she had mistaken it for something mild because nobody had clearly explained which number deserved more attention after age 60. To understand why this happens so frequently, you need to understand what those two numbers on the monitor actually represent. The top number, called systolic pressure, measures the force inside your arteries at the moment your heart contracts and pushes blood forward. The bottom number, called diastolic pressure, measures the pressure in your arteries during the resting phase between heartbeats, when the heart relaxes and refills. Both numbers matter. Both can become dangerous. But after approximately age 60, the top number usually begins telling a far more important story about long-term cardiovascular risk than most people ever realize. And that shift happens because the body you had at 35 is not the same body that is measuring blood pressure at 65, 75, or 85. When you are younger, your large arteries are flexible and elastic. They expand when the heart pumps and help absorb and soften the force of blood surging through them. But as you age, those arteries gradually lose elasticity. They become stiffer. They do not stretch as readily. They do not cushion pressure as effectively. So when the heart beats and pushes blood outward, the pressure wave meets more resistance, hits harder, and drives the systolic number upward. Meanwhile, the bottom number may remain stable or even drift lower over time. That exact pattern, a rising top number paired with a normal or declining bottom number, becomes extremely common in older adults. The medical term for it is isolated systolic hypertension. And despite its quiet appearance, it is one of the leading risk factors for stroke, heart disease, heart failure, kidney damage, and cognitive decline in people over 60. Now, here is the part that could genuinely protect your health. If you are over 60 and you are asking which blood pressure number is most dangerous on a day-to-day basis, the answer is usually the systolic number, the top number, particularly when it remains elevated consistently over time. Not because the bottom number becomes irrelevant, but because in older adults, the systolic reading is often the clearest visible marker of arterial stiffness, increased stroke risk, cardiac strain, and progressive vascular damage. This means a reading like 158/76 can be considerably more dangerous than many seniors believe. Even though that bottom number does not look alarming, the top number is telling a story about what is happening inside the arteries that deserves serious attention. Let me share the experience of Robert. Robert was 68, a retired contractor, physically active, and the kind of person who trusted his own body to tell him when something was wrong. His home readings typically hovered around 154/78, sometimes climbing to 160/80, occasionally settling at 157/76. He dismissed those numbers for months because he carried one deeply ingrained belief. If the bottom number is not high, the situation cannot be that bad. That single belief delayed treatment long enough for his heart to begin thickening from the extra workload it was performing against stiffened arteries every single day. This is exactly why isolated systolic hypertension is so dangerous. It is quiet, it is common, and it does not look as alarming as a reading where both numbers are elevated. Seniors see a bottom number under 80 and assume the overall picture is balanced, perhaps even acceptable. But what the top number may actually be communicating is that the arteries have stiffened significantly. The heart is laboring harder with every contraction. The small blood vessels in the brain are under increasing pressure, and the risk of a cardiovascular event is climbing steadily. The danger does not arrive with dramatic symptoms. It rarely announces itself with chest pain or a sudden headache. It damages organs slowly, methodically, day after day, until the consequences become impossible to reverse or ignore. However, I need to slow down for a moment because if I stopped the explanation here, the picture would still be incomplete. While the top number is usually the most important long-term warning signal after 60, the single most immediately dangerous blood pressure scenario is not simply a chronically elevated systolic reading. It is a severely elevated reading, typically above 180 systolic or above 120 diastolic, or both, especially when accompanied by alarming symptoms. That is where the conversation shifts from long-term risk management to potential emergency. Let me tell you about Rose. Rose was 73 and had always been somewhat anxious about checking her blood pressure. One morning, she woke with a pounding headache centered behind her eyes. She sat at the kitchen table, wrapped the cuff around her arm, and saw 186/118. She waited 2 minutes and measured again, 192/121. Then came the symptom that changed everything. Her vision blurred noticeably in her left eye. This was not a harmless spike caused by stress or caffeine. This was not a number to casually monitor until her next scheduled appointment. This was the kind of reading that can signal a hypertensive emergency, a situation where the brain, heart, kidneys, or major blood vessels may already be sustaining damage in real time. So let me say this as directly as possible. If your blood pressure rises above 180/120 and you are experiencing chest pain, shortness of breath, severe back pain, weakness or numbness on one side of the body, confusion, sudden difficulty speaking, or changes in vision, that is not a situation where you wait and observe. That is emergency territory. That requires immediate medical attention until a qualified professional determines otherwise. Too many seniors treat dangerously high readings like weather observations, something to note and discuss later. But blood pressure at that level combined with symptoms can be the precursor to stroke, heart attack, aortic injury, acute kidney failure, or other life-threatening events unfolding in that very moment. Now here is the twist that catches many older adults completely off guard. A very high diastolic number can absolutely be dangerous, particularly when it exceeds 120 in a crisis scenario. But outside of that acute emergency context, in seniors over 60, the bottom number frequently stops being the primary concern, while the top number becomes the dominant indicator of ongoing risk. This is why physicians who treat older adults tend to pay particularly close attention to systolic readings. Not because diastolic pressure has become meaningless, but because the physiology of aging alters the pattern of hypertension. The center of danger shifts upward, and most patients never realize that the rules they learned decades ago have quietly changed. Let me describe what happened with Leonard. Leonard was 76, disciplined about his health, and meticulous about tracking his numbers. His blood pressure log was organized and thorough. Morning readings consistently showed values around 158/68. Evening readings came in around 162/70. He believed he was doing reasonably well because he had spent decades hearing that the bottom number was the critical one to watch, and his bottom number rarely exceeded 75. What Leonard did not understand was that his pulse pressure, the numerical gap between the top and bottom readings, had been widening steadily, and that growing gap was revealing something even more concerning than either number alone. Pulse pressure is simply the difference between systolic and diastolic values. If your blood pressure is 160/70, your pulse pressure is 90. If it is 150/80, your pulse pressure is 70. As people age, a widening pulse pressure frequently reflects progressive arterial stiffness. And that matters because a larger gap between the two numbers often correlates with increased strain on the cardiovascular system. In practical terms, the heart is pumping blood into vessels that no longer absorb and distribute force the way they once did. The top number climbs higher, the bottom number may drift lower, and the entire system becomes less resilient, less forgiving, and more vulnerable to acute events. This is why a senior can look at a reading of 166/62 and completely miss the real danger. The eye naturally gravitates to the 62 and thinks that at least the lower number is not elevated. But that wide spread between 166 and 62 may actually be indicating that the arteries are aging under sustained pressure, that blood flow dynamics are becoming less efficient, and that the heart and brain are bearing costs that have not yet produced obvious symptoms. It is one of the most deceptive patterns in senior blood pressure monitoring. Not dramatic enough to trigger immediate alarm, but dangerous enough to quietly elevate the risk of stroke, heart disease, kidney injury, and functional decline over time. Let me tell you about Helen. Helen was 80 years old, mentally sharp, independent, and still driving herself to appointments and grocery shopping without assistance every week. Over the years, her blood pressure had evolved from 138/82 to 152/74 to 164/60. She focused on the declining bottom number and interpreted it as improvement. In her mind, a lower number had to be better. But what was actually happening was not improvement. Her arteries were becoming progressively stiffer, her systolic pressure was climbing, and the widening pulse pressure was becoming a more reliable marker of cardiovascular risk with each passing month. Then came the fatigue that seemed harder to shake. Then the shortness of breath walking from the parking lot to the store entrance. Then the afternoon dizziness that made her start reaching for furniture to steady herself. Helen assumed she was simply aging. But when her blood pressure pattern was properly evaluated in context, the real issue became evident. She had persistent systolic hypertension with a widening pulse pressure, and her heart had been working against that extra strain for far longer than anyone had appreciated. The monitor had been delivering accurate information the entire time. She had simply been reading the wrong part of the message. But now we need to discuss something that almost nobody anticipates hearing in a blood pressure conversation. Sometimes the most dangerous number is not the high one. Sometimes it is the bottom number falling too low. And this is where seniors encounter an entirely different category of risk. After age 60, particularly if blood pressure medication is involved, it becomes possible to lower the diastolic number so aggressively that the heart itself may not receive ideal blood flow during its resting phase between beats. This is the dimension of the blood pressure story that most people never hear about, and it can be just as consequential as an elevated reading. Consider what happened with Arthur. Arthur was 74 and had worked diligently to improve his cardiovascular health. He modified his diet, lost weight, began walking daily, and took every prescribed medication without fail. His blood pressure did improve. But then he started experiencing something unexpected: lightheadedness when he stood up from a chair, weakness during his morning shower, unsteadiness navigating the aisles at the grocery store. His readings had shifted to values like 126/56, 122/54, and 128/58. On paper, those numbers might look excellent, but Arthur felt terrible. What nobody had explained to him was that, in some seniors, lowering blood pressure too aggressively can introduce a new set of problems. The coronary arteries, the vessels that supply blood directly to the heart muscle, receive a significant portion of their blood flow during diastole, during that resting pause between heartbeats. If the diastolic pressure drops too low, especially in an older person whose arteries may already be narrowed or stiffened, blood delivery to the heart muscle can become less than ideal. That does not mean everyone with a diastolic reading in the high 50s is in immediate danger. It means context matters enormously. And in seniors, a bottom number consistently below approximately 60, especially when accompanied by symptoms like dizziness, weakness, fatigue, or falls, deserves careful evaluation rather than automatic celebration. This is where the blood pressure conversation matures beyond simple rules. The reality is that the human body after 60 does not respond to pressure changes the same way it did at 40. Good blood pressure management in older adults is not about crushing the numbers as low as possible at any cost. It is about reducing long-term risk while preserving adequate blood flow, physical stability, mental clarity, and daily independence. It is about protecting the heart without inadvertently starving it of flow, protecting the brain without making you too dizzy to stand safely, protecting the kidneys while keeping you functional and alert. That balancing act is why blood pressure management after 60 demands more nuance, more individualization, and more honest conversation than many people receive. There is another reason the systolic number takes on greater importance after 60, and it involves the brain directly. Persistently elevated systolic pressure exposes the small, delicate blood vessels inside the brain to repeated mechanical stress. Over time, that stress can contribute not only to stroke risk, but also to gradual changes in thinking, memory, processing speed, and overall cognitive function. This is one of the primary reasons high blood pressure has earned the description of a silent killer. It inflicts damage quietly, incrementally, day after day, without always producing symptoms you can feel or recognize. By the time noticeable consequences emerge, the underlying process may have been progressing for years. That is why repeated systolic elevation deserves respect and attention, even on days when you feel perfectly normal. And that brings up a crucial point about the danger of relying on symptoms alone. You cannot depend on how you feel to accurately judge whether your blood pressure is dangerous. Many seniors walk around with systolic readings in the 150s or 160s and feel entirely ordinary. No headache, no chest discomfort, no shortness of breath, no visible distress. The body adapts just enough to keep the danger concealed beneath a surface of apparent normalcy. A calm, comfortable day does not guarantee a safe blood pressure reading. Blood pressure is not evaluated by how dramatic it feels in the moment. It is evaluated by what it is doing to your arteries, heart, brain, kidneys, and circulatory system over weeks, months, and years. Now I want to address one of the most common and most dangerous misconceptions I encounter. A senior will say something like, "My top number is a little high, but my bottom number is low, so don't they sort of cancel each other out?" No, they absolutely do not cancel each other out. That belief is one of the most harmful myths in blood pressure management after 60. An elevated systolic number remains risky even if the diastolic reading is normal or low. And a low diastolic number can still be concerning even if the systolic reading appears improved. One number does not neutralize the other. In seniors, the dynamic relationship between the two numbers often tells the most important clinical story of all. So what should you actually monitor when checking blood pressure at home? Watch for patterns rather than reacting to isolated readings. If the top number is repeatedly elevated across multiple measurements taken on different days, that pattern deserves medical attention. If the bottom number consistently drops below 60 and you are experiencing symptoms like dizziness, weakness, or instability, that pattern also warrants discussion with your healthcare provider. If the gap between the two numbers keeps widening over time, do not dismiss it as meaningless arithmetic. And if an extremely high reading appears alongside alarming symptoms, act on it immediately. Do not negotiate with the monitor. Do not convince yourself it was probably just a flawed measurement. One isolated reading taken after rushing upstairs or during a moment of anxiety may not represent your true baseline. But a pattern that repeats consistently over days and weeks is your body communicating something important. That message deserves to be heard and shared with your physician. No senior should ever adjust their medication independently based on fear triggered by a single surprising number. But equally, no senior should dismiss persistent systolic hypertension simply because the bottom number appears acceptable. Both of those mistakes are common. Both carry real consequences. Blood pressure management after 60 is a careful balancing act that requires individualized medical guidance, not assumptions or internet shortcuts. Now, if you have ever wondered which number doctors historically emphasized more heavily, the answer may surprise you. For many decades, medical teaching placed significant weight on the diastolic number. Many patients were taught that the bottom number was the one to genuinely fear, and in younger adults, diastolic pressure absolutely can be critically important. But in older adults, modern medical understanding shifted because the underlying physiology shifted. Arteries stiffen with age. Systolic pressure rises as a consequence. Pulse pressure widens. The pattern and distribution of risk changes fundamentally. This means many seniors are still following an outdated mental framework designed for a younger cardiovascular system that no longer matches the reality of how their body processes pressure today. Here is the clearest summary I can offer. After age 60, your systolic number, the top reading, often becomes the louder and more consistent warning about long-term cardiovascular danger. Your diastolic number, the bottom reading, becomes critically important in two specific situations: when it is extremely high during an acute crisis, or when it has been driven too low for your body to tolerate safely. And the distance between the two numbers becomes meaningful because a widening pulse pressure can reveal arterial stiffness and changing cardiovascular dynamics that neither number alone fully captures. The most dangerous reading is rarely a single number viewed in isolation. It is almost always a pattern. And the seniors who remain safest over time are those who stop asking which number they can afford to ignore and start asking what story their overall pattern is telling. If your systolic number is persistently elevated, that is a dangerous pattern. If your blood pressure exceeds 180 over 120 and symptoms are present, that is dangerous right now. If your diastolic number has dropped too low and you feel dizzy, weak, or unsteady, that represents a different but equally real kind of danger. And if the gap between the two numbers continues widening, that is a signal worth investigating rather than dismissing. Once you internalize those four realities, blood pressure stops appearing as two disconnected digits on a screen and begins revealing itself as a genuine clinical picture. The kind of picture that can empower you to act before a crisis develops, rather than reacting after damage has already occurred. I also want to warn you about the emotional trap of false reassurance. False reassurance may be one of the most quietly destructive forces in personal health management. Panic can drive someone to seek medical attention, and sometimes that urgency saves a life. But false reassurance keeps a person sitting still, feeling comfortable, while damage accumulates in the background. A senior sees 156 over 68 and thinks at least the bottom number looks acceptable. Another senior sees 124 over 58 and thinks at least the top number is well controlled. That quiet inner voice of selective comfort is often where poor outcomes begin. Because blood pressure danger in older adults frequently hides inside readings that appear half normal and half concerning. Let me close with the experience of Denise. Denise was 67 and had maintained a reading pattern around 152 over 66 for nearly a year. She attended every appointment faithfully but never emphasized those numbers because she assumed they were only slightly off from ideal. Then one day she felt unusually winded carrying grocery bags from the car to the kitchen. Subsequent evaluation revealed that her heart had been under significantly more strain than anyone had appreciated. Was it caused by one single reading? No. It was caused by a pattern that had been underestimated and overlooked for months. And that is precisely why the most dangerous blood pressure for seniors is often the one that looks familiar enough to rationalize away. I am Dr. Emily, And here is what I want you to carry with you after today. For seniors over 60, the top number usually carries far more danger than most people understand. Extremely high readings accompanied by symptoms constitute medical emergencies that demand immediate action. A bottom number that drops too low can create its own set of risks, particularly if your body is telling you something is wrong through dizziness, weakness, or instability. And widening pulse pressure is not just an abstract calculation. It is frequently a sign that aging arteries are altering the way pressure moves through your cardiovascular system. Your blood pressure monitor is not just producing numbers, it is offering you a warning system. It is showing you whether your arteries are stiffening, whether your heart is under strain, whether your treatment is properly balanced, and whether your body may be drifting toward crisis or toward stability. But that warning system only works if you understand how to interpret what it is telling you. Track your pattern. Notice your symptoms. Bring the complete picture to your physician. Because the most dangerous blood pressure is often not the reading that looks the most frightening at first glance. It is the one you misunderstand long enough to ignore.